It was the most momentous fortnight for any British government, with the most momentous decisions taken by any British government since the war.
From this evening, I must give the British people a very simple instruction. You must stay at home.
Britain shuts down. We won't go out, we won't socialise, we won't head to work, we will not shop.
The Leviathan of the state was to deprive its citizens of their liberty.
You should now only go out when absolutely necessary for food, medicine, work or exercise.
A form of house arrest for the greater good.
Good morning, it's 6 o'clock on Tuesday the 24th of March.
People around the UK are waking up to unprecedented restrictions on the way we live.
These steps are not requests, they are rules.
And yet, Britain's deaths are among the worst in the world. This is the story of a newly mighty state with a grand plan, how it was made and how those who made it may have miscalculated. There's a theme to this crisis. It's time. Infections per day, deaths per week. When to lock down. How long to lock down for. Too early, too late. You wouldn't always know it from the coverage, but there was quite a bit that the politicians and scientists actually got right during this crisis. But it was these central questions about time and timing that you can argue they got most wrong. Right at the very start, the scientists made an assumption about all of us, about how we might behave, that some now say not only proved wrong, but was disastrous. By mid-March, COVID-19 had become entrenched in Europe. Italy was the epicenter. But as its tentacles spread across the continent, government after government began to shut down their societies. Questions were asked as to why the British government wasn't doing the same. One of the reasons was a belief that if those measures were brought in too soon, the consequences could be dire. It was an assumption which underpinned the models ministers received, models produced by SPY-M, effectively the government's very own scientific modelling service.
This was something that was widely discussed by many academics throughout March and into April, that you need to make sure that people are complying at the time that we predicted the epidemic was going to peak. So working on the idea of, say, 4 to 5 weeks at which adherence was possible, then this could influence the timing of lockdown coming in. What you don't want is a situation where you might introduce lockdown too early and then, say, 4 to 5 weeks, people start to experience fatigue, adherence drops right about the time the epidemic is going to peak, and then, of course, you get many more cases. I think in hindsight, we can look back and say, actually, overwhelmingly, adherence to lockdown was fantastic.
Well, where did the idea that was widely discussed at the time that it would only last and people could only endure it for 4 to 5 weeks come from?
So I'm not quite clear where this idea came from. I know it's something that the Chief Medical Officer was concerned about, and it was raised in March.
Indeed it was, a theme Chris Whitty and other scientists spoke of repeatedly.
It is important on this. It's not just a matter of what you do, it is also a matter of when you do it. Because anything we do, we've got to be able to sustain. Once we've started these things, we will have to continue them through the peak, and that is for a period of time. And there is a risk if we go too early, people will understandably get fatigued, and it'll be difficult to sustain this over time.
But that didn't turn out to be true. And curiously, there doesn't appear to have been much evidence for it at the time either. SPY-B is another scientific advisory body which focuses on and advises government about human behaviour and psychology. If evidence for this idea of lockdown fatigue had any basis, you might think that they would have been the ones who came up with it. Not so.
This term, behavioural fatigue, seemed to have somehow emerged at a fairly early stage in the process. Certainly didn't come from SPY-B, and it's not a behavioural science term. If you look in the literature, you won't find it because it doesn't exist. There's speculation about where it came from, but it was a potentially problematic term because it grossly oversimplifies what is quite a nuanced situation.
This isn't hindsight either. There were plenty who expressed scepticism of this idea at the time.
The advice from the scientific experts beside Boris Johnson today was, if you do too much too soon. There'll be fatigue and people won't get bothered by it. Really?
Well, I would like to see the modelling behind that, and I have my own concerns.
So if Jeremy Hunt had got his wish, what would he have seen? Minutes from the relevant meetings are contradictory. Spy B minutes from the 4th of March say,
empirical evidence for the behavioural and social impact of and adherence to each of the strategies is limited. We are not aware of any evidence on their interaction. These comments are therefore based on the collated expert opinions of Spy B participants.
But curiously, the main SAGE minutes from the 13th of March record the following.
There is some evidence that people find quarantining harder to comply with the longer it goes on. The evidence is not strong, but the effect is intuitive. There is no comparable evidence for social distancing measures, but experience suggests it is harder to comply with a challenging behaviour over a long period than over a short period.
But then it goes on to say,
there is no strong evidence for public compliance rates changing during a major emergency.
So if the idea didn't come from Spy B, then where did it come from? One theory we've been pointed to by scientists and officials is that it came from the so-called Nudge Group, a Whitehall body which makes insights into human behaviour to help governments achieve their goals. Its head is David Halpern. In early March, in an unbroadcast BBC interview, he said this.
A simple example would be, as Chris Whitty has talked about, very soon people are going to be asked if you've got a kind of a cough and so on, or certainly a light fever or anything like it, just to self-isolate. But at the moment we're still in flu season, so most people who do that right now, then it's probably not coronavirus. So, you know, if you can have 2 or 3 of them over the next few months, you know, oh my goodness, again. So it's exactly a good illustration. You don't want to cry wolf. You want to start asking people to do these things, which are potentially quite a big ask, when they're likely to be effective.
The Nudge Unit has told us that the idea of lockdown fatigue did not originate with them. They
categorically never proposed or suggested behavioural fatigue with respect to COVID-19, and in particular never proposed fatigue as grounds to delay or shorten social distancing or any other measures aimed at COVID-19. However the phrase entered the public or policy discourse, it was not from us.
Mr. Halpern declined our request for an interview. Nonetheless, at the time, the intuitive power of lockdown fatigue was widely cited.
An important part of the science on this is actually the behavioural science, and what that shows is probably common sense to everybody in this audience, which is that people start off with the best of intentions, but enthusiasm at a certain point starts to flag.
Common sense, intuition, what comes naturally. This, with regards to behavioural fatigue, appears to be all there was. In other words, this was a bit of a hunch, but a hunch of great importance, because if ministers hadn't been told this, it is at least conceivable that they would have chosen to lock down earlier, and as many scientists have since said, many lives could have been spared. It is also a pretty difficult charge against any scientist or group of scientists to base such a central planning assumption of such consequence on something for which there doesn't appear to be any evidence.
There's no science behind the idea of behavioural fatigue. There are some parallel situations, for example, in emergencies, where after a period of time, people kind of get used to being in an emergency situation. But that's a completely different thing. As a behavioural scientist, we're quite used to people who aren't behavioural scientists coming up with ideas and they seem perfectly commonsensical to them. And speaking in rather loose terms about things that actually there is a scientific basis for. So you know, I couldn't blame someone like Chris for saying, you know, for bringing up this notion of behavioural fatigue. But I think at a very early stage, the government should have said, actually, that's not a thing. And, you know, that was kind of just a phrase that was brought out of thin air.
But there was another assumption which underpinned the thinking in those early weeks. It was a judgment on where we were in the epidemic cycle.
So we think that the peak may be something like 10 to 14 weeks away. It could be a bit longer.
But they were wrong. Our peak wasn't 10 to 14 weeks away. Had Sir Patrick Vallance been right, we'd have been experiencing a peak in deaths in late May or early June. Instead, we probably hit it on April the 8th. There was far more COVID in the system than they believed. Within days, as new data came in, government quickly changed its tune. We weren't as far behind Southern Europe as they thought.
I said that I thought we were perhaps 4 weeks behind where Italy was. I think the new numbers suggest we're maybe
more like 3 weeks in terms of that.
It was a fateful mistake, as Sir Patrick has since admitted.
Actually, everything that we were looking at was probably about 2 to 3 weeks out of date in terms of what the infection was doing in the community. So yeah, I think that was a big error, and I think that has undoubtedly led to the large number of deaths that we've had, and also to the duration of the lockdown. Because if you start your lockdown sooner, it goes away quicker because you've got fewer cases to get back down again.
So 2 assumptions about time. How long we'd accept lockdown, where we were on the epidemic curve. 2 critical assumptions which affected all that was to follow were wrong. Now you might say that this lets the politicians off the hook. After all, they received the advice on asymptomatic transmission, on where we were on the curve, on when we might fatigue. And they listened to it. They listened to the experts, and that is commendable. And there is some truth in that. But it's also true to say that by ministers' own admission, we didn't know much about this disease. And yet, when we look back, some would say that politicians took decisions, almost as if they did. Even government's own modellers now say that some of their work and assumptions ought to have been treated with more caution.
Models should only form part of a decision-making process. They have a role, but what we need to remember is that these are models. They are a description of reality, and they can certainly provide advice, but a decision-maker needs to take into account expertise from a wide range of areas in terms of making a decision.
Indeed, there are many who would have liked to have seen less advice from the modellers and more from those with experience of the management of public health.
You get the advice that you ask for. So the government appears to be relying very heavily on modellers and behavioural scientists, who are very important, of course. But what's really clear is that there was not enough input from the public health experts and the communicable disease control experts. The people who understood how to manage epidemics on the ground and who had the day-to-day experience of dealing with epidemics and infectious diseases. They were not at the table, and they should have been directing the operations.
In other words, some of Britain's COVID travails were centred in the limitations of building models to time a lockdown when data was incomplete at best. Other countries sometimes appeared more cognizant of this. They didn't wait. They employed the so-called precautionary principle, the idea that if you don't know, if you can't be sure, then you err on the side of caution. When your data is so incomplete, you assume that you can't calibrate or gain something finally. Sometimes, instead, our government appeared as if it was a little bit too enamoured with the science and the scientists around them, despite its reputation for populism. They were waiting for the data to come in to tell them they had a problem, by which time they already had a problem.
I think there is a question that if you commit to taking scientific advice and following it, and my committee has heard that in every material respect the government has followed the scientific advice, then there is something in the nature of a scientific body that they're going to proceed on a scientific basis. In other words, on the basis of evidence. Now, of course, that's important and that's rigorous, but literally it takes time for evidence to come in, to be collected, to be analysed, and then conclusions to be drawn. And it may be that other countries that didn't make such a big and public commitment to following the science were freer to make judgments that anticipated, if I can put it that way, the evidence.
I followed the advice of our world-leading scientists.
At each point, we've been following scientific and medical advice.
We are following the expert scientific and medical advice.
We must continue to follow the scientific evidence.
That's the key verb in all this, follow. But by the time the politicians followed, by the time the scientists had calibrated finally, sometimes the right moment, the right time, had already passed. It is a curiosity that some countries with so much less scientific capacity than our own fared so much better than we. Perhaps this is one of the reasons. Either way, as we look to the future at the possibility of a second wave, the calculations and potential errors of the past, both scientific and political, entwined as they are, ought not to be far from our thinking in the present.
That was Lewis Goodall. Well, we asked the Department for Health and Social Care and the Government Office for Science for someone to join us. No one was available. A government spokesperson said, at every stage we have been guided by the advice of experts from SAGE and its subcommittees, and our response ensured the NHS was not overwhelmed, even at the virus's peak, so that everyone was always able to get the best possible care.